Thank you, Madam Speaker. The Minister of Health and Wellness recognized recently that the time was of the essence to get a bilateral pharmacare deal done for Nova Scotians. This money has been on the table for months, and the government hasn't made a deal happen. Why is the government moving so slowly to get a pharmacare deal done?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. I thank the member for the question that I've answered at least 6 times in the last 3 weeks. So the conversation continues. We appreciate that there is an opportunity for Nova Scotians, but we also have to look at the sustainability of this program. We need to make sure that when the money sunsets, and it inevitably will, that this is a program that we're able to continue. We're also working with experts in the field to make sure that the information in the potential negotiations is actually meeting the needs of Nova Scotians. So we understand that there is an opportunity here. We're in constant conversation, and we will do what we think is best for Nova Scotians.
I recognize the Honourable Member for Halifax-Chebucto.
Thank you, Speaker, and we will continue asking because the federal funding for pharmacare that is on the table would substantially reduce the cost for Nova Scotians who are currently struggling to afford food and housing. It would also be economically beneficial for the province because programs that offer free birth control have been shown to be revenue positive. The cost of providing free birth control is considerably lower than the costs associated with unintended pregnancy. Why is the government not acting in the best interest of Nova Scotians when it comes to free birth control?
I recognize the Honourable Minister of Health and Wellness.
These negotiations cannot be rushed. These conversations cannot be rushed. We see when we rush, we can make a mistake. Certainly, the childcare deal could have been a more robust deal. It could have included our private daycare owners. We need to be careful when we go forward. There are a number of things that we're doing to support Nova Scotians with access to birth control, but also access to diabetes care. We've introduced the continuous glucose monitoring program. We've expanded the pump program. We are working very hard to do the right things that are practical for Nova Scotians and knowing that there are infinite requests on a finite resource, and we will continue to do that. Thank you.